Hey there, friends. My name is Jonathan Lucero McKinney. I am a practicing physician assistant. I live in Providence, Rhode Island, and I'm passionate about LGBTQ plus care. And one of the goals of this channel is to highlight LGBTQ plus health-related research, bring it to the light, and hopefully it can improve your lives in some way, or you can share it with someone who this research might help. So today's topic is going to be about prostate cancer and screening for prostate cancer in transgender women. Very important topic, as prostate cancer is the second leading cause of death among men, just behind lung cancer. And so one of the ways we screen for prostate cancer is what's called a PSA, which is a prostate-specific antigen. And so this article is from the European Urology, the Association of European Urology. It was published in 2023, earlier this year. Thank you, Mr. Fornouche, for your studies here and the rest of your colleagues. Let's jump right in. So a little bit of background we need for this is that the current estimate is about 0.4% to 1.3% of the worldwide population is transgender. So if we're assuming about 1% of those people, that's a lot of people. That's 78 million people. And just in the United States alone, we have 1.4 million transgender people. And if we look at the metrics and track it over time, it's double that of 2001. And I think that's largely due to advancing acceptiveness. There's policies to support transgender individuals, which, although we still have a lot of work to be done, are moving in the right direction. That transgender women, it's important to note that they retain the prostate even after gender-affirming surgery. So let's rewind a little bit. Transgender women, that is a person who was assigned male at birth with male reproductive glands and hormones and genitalia that identifies as a woman. Okay, their gender identification is woman, even though they were assigned male at birth. And so the organs that they were born with are, penis, testes, and the prostate. And there are a number of different gender-affirming surgeries that a transgender woman can undergo to feminize themselves. Whether it's removing the testes, the penis, even like a vaginoplasty and creating a vagina. But one thing to note is that the prostate, just because of its anatomy and where it's located, it is retained. You continue to keep that prostate gland. And so we'll talk a little bit more about that, but that's a huge part of this. The American Cancer Society in 2023 reported 288,300 new cases of prostate cancer, and of those, 34,000 deaths. 1 in 8 men are diagnosed, and with an average age of diagnosis at age 66. It is more common with advanced age and also in people of color, black men. However, most die with it, not from it. There are 3.1 million living with it in 2023. It, as a cancer in and of itself, because of early detection and advanced treatment options, our rates of death from this has declined by about half from 1993 to 2013. And an important piece of that is the early detection. And there is a ton of research out there about prostate cancer, but very little research about how gender-affirming hormones and people who are seeking feminization and how that interacts with this hormonal axis with the prostate. And overall, the goal of today is we're going to review the literature that was published in this article on prostate cancer, the incidence, and any recommendations that they have on PSA screening in transgender women. This overall accompanies 27 different publications that the authors looked at and analyzed. I do want to show a real quick infographic about the hormonal balance and how things work with the prostate. So the hypothalamus, which is within our brain, secretes hormones, luteinizing hormone, releasing hormone, etc. And this goes down and it can affect the testes and the adrenal glands. All right. These testes and the adrenal glands can produce testosterone, which is then hormonally active within the prostate. This can cause growth of the prostate, and overall, this is why I want to talk about prostate cancer in the context of gender affirming hormone treatments for transgender women. Because transgender women are typically taking, some sort of feminization hormones, which reduce the levels of testosterone. And how does that impact prostate tissue and the incidence of prostate cancer? And so if you're at all familiar with breast cancer, I seem to be seeing a lot of commercials about that. And you'll hear, HR positive, HER2 negative, progesterone receptors, estrogen receptors. And all of that is tying into the fact that we can target specific therapies based on the cancer cells and if they are hormonally active. And so this applies to prostate cancer because one of our treatments for prostate cancer is trying to reduce the levels of testosterone. So for transgender individuals who already have lower levels of testosterone because of gender affirming hormone therapy, would that reduce the risk of prostate cancer? That's the question. So incidence of prostate cancer in transgender women, overall unknown. It's unclear how hormone therapy affects the incidence. Prostate cancer awareness is a big one. So are transgender individuals, do they even know that they're at risk of this? There was a study that the authors looked at that showed that there was increased awareness that was associated with higher levels of education, and that also if they did have gender affirming surgery, if the surgeon performing that surgery provided emphasis on prostate cancer awareness, telling the patient, hey, we're going to do this, this, and this to provide feminizing care for you, but just be aware that you're going to retain your prostate. Big thing there. There was one study the authors note in the National Cancer Database, records showing that found that survival among transgender individual patients was worse when compared to cisgender patients, although no data available for GAHT as gender affirming hormone therapies for the patients studied. So survival's worse if you're a transgender woman and you have prostate cancer. Why is that? We're going to dive into that more. There are 10 case reports that the authors looked at within transgender women and prostate cancer. All of them underwent gender affirming hormone therapy before their diagnosis. And this gender affirming hormones, things like estrogens for feminization, GnRH agonists, which is gonadotropin releasing hormone agonists, working on that hypothalamus and kind of adrenal axis kind of thing, as well as testosterone antagonists or testosterone blockers. And there can be a combination of all of these things. So the PSA, which is the prostate specific antigen, at diagnosis ranged between 3.3 to over 1700. And mind you, the normal level for a PSA generally is less than 4. All right. And it is likely that some of the men had prostate cancer prior to starting gender affirming hormone therapy. And there raises this question of castrate resistance prostate cancer. What that means, castration is a word to say, removing the male sex hormones, right? So castration, are if by the removal of testosterone can we treat the prostate cancer, and that there are resistant cancers from the testosterone hormone. Are these transgender women more at risk for these castrate resistant, in other words, non-testosterone sensitive prostate cancers? It seems that way, which we're gonna talk about a little bit more later. But first, PSA screening. General guidelines encourage a one-on-one discussion. It is incredibly based on shared decision making. The patient's history, family history about screening for PSA. It's a really in-depth conversation that I have with patients about, generally at age 55, we're starting this conversation, whether to screen with PSA or not. And screening with PSA, sure, has upsides and downsides. And the big downsides being false positives, where then the next step, getting prostate biopsies. Biopsies have risks. One of them being erectile dysfunction, urinary dysfunction, fecal incontinence, all sorts of things. And you could have a false negative, and this biopsy could be off or not. So, really important conversation to have with your provider. So, we do know that gender-affirming hormone therapy are known to lower PSA levels. Again, I talked about the normal level for a PSA is around 4 and less. Well, the PSA levels decrease often to undetectable levels in in people taking gender affirming hormone therapies. And this is similar to androgen deprivation therapy. Androgens are male sex hormones, which is known to be a treatment for prostate cancer. And it has been empirically shown that gender affirming hormone therapy is associated with a relatively lower risk of prostate cancer. And this would make sense because, like I said, the treatments for prostate cancer can be the removal of testosterone from the equation to help reduce the hypertrophy, the growth of these prostate cancer cells. One study, a retrospective cohort study, there was a 5-fold decrease in prostate cancer risk in trans women using this gender-affirming hormone therapy, things like estrogens, testosterone blockers, when compared to cisgender males of a similar age. Although normal PSA cutoffs for cisgender individuals need to be adjusted to reflect for PSA decreases caused by these testosterone blockers, these estrogens, and that the exact cutoffs remain to be elucidated. And this is one thing that we need in further research. We need to find out, do we screen with PSAs? And if so, what do we use as a cutoff level? Do we use that arbitrary level of 4 or less as a normal value, or do we have to adopt a new level? There are previous studies that have suggested that those who had bilateral orchiectomy, orchio meaning the testes, the testicles, and ectomy meaning to remove, so removal of the testicles, are undergoing treatment with estrogens. The upper limit of normal for PSA should be about 1 nanogram per milliliter. So that is the suggestion. Moving forward, among 292 trans women in studies from 2014 to 2018, there are low rates of PSA screening and shared decision-making when compared to cisgender men. Overall, we're doing a poor job at educating transgender women about A, you have a prostate, and B, that this is something that we need to discuss with this prostate-specific antigen and screening for cancer. There is no international consensus on whether to screen trans women before the initiation of gender-affirming hormone therapies or how to screen them. Most urological societies do not make any PSA screening recommendations. For example, the European Association of Urology, the Canadian Urological Association, they give very clear screening recommendations for cisgender men, but nothing about how to screen transgender women. USA guidelines such as the USPSTF, which is the United States Preventative Services Task Force, the AUA, which is the American Urological Association, and the NCCN, which is the National Council on Cancer Network. I forget my acronyms there. Important organizations. They refer exclusively cisgender men, and that notably there is an absence of any language of trans women. It's not inclusive of transgender women and the notion that they keep their prostate. And so, again, a huge area of research that needs to be done. I think I'm highlighting and foreshadowing that we need a lot more research done on this topic. So, there are no clear cutoffs for PSA in this population. The authors do provide some insight. They say, we believe that the PSA screening should occur before the initiation of gender-affirming hormone therapy when it is age-appropriate. And that you should follow the guidelines within your organization, within your country, to identify those with elevated PSAs and help normalize undergoing PSA screening for transgender women. Understanding, any providers are watching that trans women still retain their prostate, and it's an important conversation to have with them. And in addition, among patients who do start gender-affirming hormone therapy at younger ages, which is something that we're seeing more commonly, we propose that PSA screening should be considered once those patients reach an appropriate age to establish baseline levels. What is that age? Again, from the USPSTF for the United States guidelines, we start that conversation around age 55. Earlier if you have a family history of prostate cancer. But although future research should understand the optimal timing of PSA and really how the gender-affirming hormones play into this conversation. So where do we go from here? What are the next steps? Based on the existing literature, we cannot offer any specific clinical guidance on PSA screening and the interpretation on transgender women, particularly those on gender-affirming hormone therapy. Remember, not all transgender individuals are going to be on gender-affirming, whether it's feminization or masculinizing therapies. And that of the 10 cases that I discussed earlier, reports on prostate cancer in trans women have been published to date. There's only 10 case reports. And it remains unclear whether prostate cancer in transgender women is underdiagnosed or whether it's truly a rare phenomenon. Are we not screening enough, so we therefore underdiagnose, or is it truly rare because we are essentially providing castrate therapy for these individuals, which thereby reduces the risk of prostate cancer? This this hormone axis between the hypothalamus, the testes, the luteinizing hormone, FSH, LH, all these things really come into play here. We speculate, and this is the authors, that transgender women on gender affirming hormone therapy may be at risk of a poorer prognosis, particularly given the additional barrier of denial of dysphoria about having a prostate, which is generally considered a male cancer. And we don't know when prostate cancer screening should occur. They note that of the people, of these 10 case reports, 6 out of 9, again, one of those case reports didn't have the data to be included in this analysis, but 6 out of 9 of those case reports did have metastatic, meaning cancer that has spread from the prostate to other areas of the body. 6 of 9 had metastatic disease at the time of diagnosis. And also, 6 of 9 had higher PSA levels, greater than 10. And so your typical cisgender male, again, the average age of diagnosis around 66, that PSA level on average at diagnosis is typically less than 10. So when we're looking at these transgender women who 6 out of 9 had a PSA greater than 10, does this represent that transgender women are going, if they're going to get prostate cancer, it is going to be more aggressive and it is going to be castrate resistant, thereby a poorer prognosis? Lots more research. We need it. We need it. We need it. When and how do we measure PSA in this population? Big question. Should it be before starting the gender affirming care? Should it be serially thereafter? Should we start it at the age that we typically do for cisgender men? What is the cutoff levels? That is all remain to be seen. And I hope that you've learned something from this video, because this article has highlighted more questions for me than answers. I think it's important to talk to a provider and be comfortable with a provider that you have in discussing these things. It's important to put on the table. Transgender individuals, we need to continue researching topics that pertain to the transgender community and how that we can best care for our patients. And so thank you guys for watching. I hope you learned something. Please like, comment any questions, subscribe, and hit that bell notification so you don't miss any of the content. And as always, don't forget to live your life out loud.